Hi, you're right. Thanks for tuning in. I'm Jamie and this is my channel. Get comfy, make yourself a cuppa and let's have a chat. This channel is all about empowering and uplifting families who have been affected by baby loss. I do this by sharing my stories with you. Today's video is all about answering miscarriage questions. I've been getting a bunch of questions in my direct messages on Instagram and I'm going to try and answer as many of those as I can. So you may see me looking down, but that's just to have a quick look on my tablet to see the questions that people have been asking from Instagram. So the first question is, how do I know that I'm having a miscarriage? And this is one of those questions that a lot of people asked, and it varies from person to person. For example, with my miscarriage, I didn't have any symptoms whatsoever and didn't actually find out I was miscarrying until my 12-week scan. With my second trimester miscarriages, my waters broke, but I didn't actually go into labour. But typically what they say is that if you're having cramping or bleeding, then sometimes this can indicate a miscarriage. So what are the main causes of miscarriage? Now, I know that miscarriage is unpreventable, but there are some medical complications that can result in a miscarriage. For example, if you have any infections like STIs or UTIs, these can sometimes lead to miscarriages. I, at one stage or another, have been diagnosed with having UTIs, having an incompetent cervix, having an infection, and all of these, after further investigation, have been ruled out. But originally, these were some of the diagnoses given to me when I was going through my miscarriages. I now have a definitive diagnosis, which I will be sharing in a further video. How soon after a miscarriage can we try to conceive again? Now, I think this is down to the individual and it's down to your circumstances, and it's also down to if you're still healing or bleeding after you've had a miscarriage. It depends on what type of miscarriage you had and at what stage, and it's down to the individual. So that means it's an individual choice as to whether you want to try and conceive straight away or you want to wait. If you want to try again, then try again. Medical professionals will always tell you to wait till you've at least had one cycle. I think this is just makes everything easier. So it's easier for them to work out when your baby will be due, when they know when you last had a period, and you know, it's easier for them. So you can wait till you've had one cycle, or you can just try. For me personally, I had a lot of healing to do. I had a lot of mental healing to do and physical. So therefore, I didn't start trying to get pregnant again straight away. And also, because I was healing, it took me some time to have my ovulation sort of recalculate, my cycles recalculate. It was a mess and it took roughly a year to get pregnant again. But it's down to you, it's your choice, do what's right for you. This question is, what can we do to prevent a miscarriage? Miscarriages for the most part go unexplained, which means that trying to prevent them is not really possible, but medical professionals and the NHS in the UK always suggest that you give up alcohol, smoking, and maintain a healthy, balanced diet, as well as stop using any illegal drugs that you may have been using before you got pregnant, all of which you will probably do anyway. So there isn't really a definitive answer to how to prevent miscarriages because nobody really knows. So the next question is, when will I get my period back after a miscarriage? Now, this varies from person to person, and even in my experience, it varied miscarriage to miscarriage. So with my early pregnancies, I didn't take that long to get my cycle back. I would say within 3 to 6 months my cycle was back on track when I'd miscarried earlier on. So this was my miscarriage. With my second trimester miscarriages, it took a lot longer for my cycle to normalise and come back. So I would say it roughly took between 3 to 6 months for my period to even start again, and then probably 6 to 9 months for it to come at the same time and, you know, be regular. Your body's going to do whatever it wants to do, and it's completely out of your control. So in this time, try and heal mentally, physically, and just let your body do what it needs to do to get you back on track. There's no time scale, and with each of my miscarriages, the time that my period has taken to come back has been different, and it will be unique to you and your body and what trauma it's gone through. Especially with my second trimester miscarriage, I had so much trauma down below that it took ages for anything to get back on track. I remember bleeding for 9 weeks straight, not having a period for 2 months. It was all over the show, honestly. Don't forget to hit that like button and leave me a comment down below. The next question is, what happens to my baby after a miscarriage? So that's the one thing that I would do differently. I would have postmortems done of my babies after I had a miscarriage. I've been told by several consultants that this would have really helped to reach a diagnosis sooner rather than later. That option is not available to you. Each hospital deals with your baby differently. I've had baby loss in 2 different hospitals in my area, and they both dealt with them differently. One was really good, one wasn't that great, but typically I would be asked if I wanted a post-mortem. Once the decision has been made about whether your baby needs a post-mortem or not, your baby is then taken away and you will be offered a funeral or a cremation. My second trimester miscarriage, we had a funeral. So we had a priest come in and set out an order of service. We had somebody carry the baby in, and it was completely handled and taken care of financially by the hospital and by the funeral service. So we didn't have any cost, but we were involved. So we planned hymns and readings and poems and had a service that we could have invited family and friends to. With my second trimester miscarriage, we had this baby in the middle of COVID. So I was given 30 minutes in a crematorium with my baby, and then the ashes were given to me a few weeks later. I collected those. The ashes were scattered across my grandmother's grave. Okay, so this is the question that I got in my DMs on Instagram, which is, my mum experienced reoccurrent miscarriage. Does this mean that I also will go on to have miscarriages? Now, miscarriage is not hereditary, but if there are enough women in your family, then you will definitely hear stories from those women about miscarriages, because it affects 1 in 4. So family of whatever size, as long as there's a few females in it, it's very possible that one of them might have experienced miscarriage. But this does not mean that you will go on to have a miscarriage. And if you feel that you want to mention it to a midwife, if you are aware of it prior to getting pregnant, you can mention it to your doctor, and it's always helpful to know your family history, but there is no link. Does a woman's age increase the risk of miscarriage? As a woman gets older, the chances of your baby being born with birth defects such as Down syndrome does increase. So if you are over 35, which is what I am, then you have a 1 in 4 chance of your baby developing Down syndrome. This increases to 1 in 1,500 if you are under 35. Women aged 35 and over have a 20% risk of miscarrying, and a woman who is 40 or over, that figure triples. But listen, don't let that put you off, and don't let that scare you. I know women over 35 and over 40 who have gone on to have healthy babies. So I was asked if stress leads to miscarriage, and there is no connection between stress causing miscarriage. Being pregnant is stressful, and you'll always be advised to reduce the amount of stress you have in your life when you're pregnant. But if you're a woman that's had multiple miscarriages, then you're gonna be anxious, you're gonna be stressed out. But if this starts to affect your mental health and you feel that you're becoming depressed or your anxiety is becoming crippling, then speak to your GP, speak to your midwife, and ask for some help, because it is a very difficult time, especially if you're in the same shoes as me and you've had multiple miscarriages. You can't help but worry. But if it's getting out of control, you do need to seek some help. Does a man's age increase the risk of miscarriage? No. Men don't have to worry about any of those kind of issues. If you're concerned about sperm quality or sperm quantity or have any kind of fertility issues, speak to your GP. There are tests that they can carry out, but men don't have to worry about getting older and having issues that would have lead to a woman's miscarriage. If you get pregnant, then there's basically nothing to worry about when it comes to the man, and being older is not going to lead to you having a miscarriage. The next question is, will I have tests done to find out why I miscarried? Now, in the UK, in order to get a diagnosis or for it to be flagged up as a concern, you need to have 3 miscarriages before they will refer you to a recurrent miscarriage clinic for diagnosis. The recurrent miscarriage clinic can run special tests that your GP does not have access to, and it's only once you've had those 3 miscarriages that referral will be done and those investigations can take place. If you happen to have a 2nd or 3rd trimester pregnancy loss, then obviously a post-mortem will be offered, and it's up to you if you want to have that done. They can find something that is important from a post-mortem. Now this lady asks, what should we do if we experience multiple miscarriages? Now, I would hope if you've had multiple miscarriages that your midwife or your consultant or any medical professional at this point has made a referral to the recurrent miscarriage team for an investigation. If this has not been done, and in my case, I actually had to go directly to my GP and ask them, after my second trimester miscarriage, after spending all that time in hospital, everything I went through with my second trimester miscarriage, I still had to ask my GP to make a referral to a recurrent miscarriage unit. This was all happening in the middle of COVID, so I ended up going on a wait list. I waited maybe 2 or 3 months before my referral was acknowledged, and then they started to see patients via Zoom, over the phone. So a lot of my initial conversations were done online with a consultant video call, etc. And then if I required blood tests or scans, then I would come in for those. Those were still available to me. but you do have to be patient, you do have to wait. This is the NHS, you must know what you're dealing with, and sometimes if you can afford to have some tests done privately, they are not cheap. The NHS is available to us free of charge, but it does unfortunately come with a waiting list, and that's not always, conducive to you wanting to try it straight away and wanting to get answers straight away. It just doesn't happen like that, and you just have I want you to know that you're not alone in how you feel and what you're going through. I've created a playlist that details all my miscarriage stories and what I've learned whilst dealing with a miscarriage. So if you know anyone who's going through a miscarriage, send them this playlist in the hopes that it might comfort them. If you've made it this far in the video, why not hit the subscribe button and the notification bell to know when I upload videos, which is every week. So someone asked me if they can choose the way their miscarriage is managed. And the answer to this depends on your circumstance. So for me, I've had 2 different types of treatment. Now, medical professionals will always go for the most natural. So even when my waters broke with my 2nd trimester miscarriages, they wanted to wait and see if I would go into labour. It was only because of infection and complications that they induced labour. Otherwise, they send you home and they say come back when your labour starts. That didn't happen for me. I then ended up hemorrhaging and having emergency surgery and emergency D&C, so I didn't get a choice. What are my rights at work? Can I have time off after a miscarriage? Every employer is different. My employer has been really good with me throughout all my miscarriages. I've been with the same employer, so they know my history and they've always been very understanding. But it's down to you to read your contracts, your sickness policies with your company. If you have access to a union, then get your union rep involved, tell them your circumstances, and maybe they can look up the policies that are relevant to you and see if there is any support or extra support that you can get from your employer regarding getting time off, compassionate leave, maybe moving some annual leave around, whatever is available. If you need time, then hopefully you've got a decent employer and they're understanding and accommodate this. When I was looking to be referred to a specialist, I did my own research. As I say, my hospital didn't refer me to a specialist. I got my GP to refer me, and I found Tommy's. And this video is not sponsored by Tommy's. They don't know I'm making this video. This is just because they helped me. And if I can share with you my experience with them and what I gained from them, then maybe they will be able to help you and work for you. So I went on to their website and called up and spoke to a lovely midwife who gave me some sound advice, some advice that allowed me to get in touch with a specialist who I feel has given me a diagnosis and a plan that suits my life and my situation, and I'm confident that when I get pregnant again that things will happen smoothly. Nothing is guaranteed, but they did a lot of tests. They were very patient with me and very understanding. Now, this specialist was based in London and I don't live in London. When I asked my GP to refer me, he insisted that I use the services in my area. First, that it was not typical to refer you to a London service when you don't live in London. But the problem with that is that every hospital and every specialist specialises in different things, and each consultant and each hospital tests for different things and makes different things a priority. I've seen specialists who are very focused on an infection I had 3 years ago. I've seen a specialist who is very focused on the diagnosis that I have now. So without obviously going into detail about the diagnosis that I have, they all focused on different things. So sometimes you want to be referred to a specialist and you can't. But if all the treatments were standardized, we wouldn't have this problem. Now, I strongly believe in what Tommy's does, and I have signed their petition, and I'll be leaving a link below to share this petition with you. Maybe you want to sign it, maybe you can send it to someone else who has been affected and wants to sign it. But I'm very passionate about women's health, and I'm very passionate about what Tommy's do. And this video has not been sponsored by them, but I just feel that I need to share the good works that they do because they have really helped me a lot. If you or someone you know has been affected by miscarriage, then leave me an orange heart in the comments below.